Pregnancy after the 30s. More and more women nowadays are opting to have their first baby after the age of 30 years due to various reasons, like they are busy with their career, they are doing their education, they want to have their child late and things like that. But that has always been the biggest hurdle in fertility treatment, because as the women's age increases, it becomes more difficult for us to give a good fertility success rate. As important as your career is, it is important for women to plan their first baby by the time they are 33 and not postpone too much. And if at all they are planning to postpone their pregnancy, they must take care of their health. Do a basic blood test, see if they have any risk factors like thyroid or sugar, and they should have a general checkup done to ensure that they are healthy. At the max, I would say that by 34 they should have completed their family or had at least one baby by the age of 34. It is very common to see that by the age of 35, the egg forming capacity of a woman keeps coming down, and it is more common among Indian women where their egg forming capacity starts to decrease once they hit the 35 milestone. So it is very important to keep this in mind while you make a choice to postpone your pregnancy. There are various options of treatment available if in case a woman decides to postpone her pregnancy. There are various options of treatment that can be given to her. Some women do opt for options like egg freezing, where at a younger age they freeze their eggs through a simple IVF process, which involves taking some injections for 10 days. Many eggs are formed in her body, and those eggs are taken collected from the body under mild anesthesia, and they can be frozen and kept in the laboratory. And if they decide to have a baby at the later ages of 37, 38, these eggs can be used to be fertilized with the sperms, and an embryo can be formed, and it can be placed inside the uterus. Many of the celebrities, especially in the Hollywood, we do see that they have their first child at a very late age, but many don't speak about what went into having the baby at a late age, and that should be kept in mind while you are planning to postpone your pregnancy. And when you already know that you have a history of problems, like you know that you have PCOD, or you know that you have a fibroid uterus, or any other or you have a diabetes, early age diabetes, then you must at least complete your first baby at an earlier age, and you can probably postpone having the second baby to a later age, so that you don't complicate things and you have a smooth process without going into any artificial intervention before you have a baby.